Friday to you, and welcome to the Friday 5 here on the Agent Survival Guide podcast. This is our weekly list of 5 things you should know about. I'm your host, Sarah Ruppel, and today is Friday, July 31st. We are at the end of another month. It is hard to believe how quickly this summer is flying by, but here we are, in the midst of preparing for the upcoming enrollment seasons. Now, here on the show, we mention a lot of resources, and I recently found myself in need of one that we haven't talked about as much on the show: continuing education resources. There are quite a few places to purchase CE courses to fulfill state licensing requirements. I've looked into those briefly here and there, but I'm most excited about the option within IntegrityCONNECT because of the way it's set up. Integrity has partnered with RegEd to provide access to continuing education courses for a flat annual fee of $40. Courses are available for all 50 states, and after that annual fee, you'll only pay the state fees with the first certificate included, and then additional state certificates are $20 each. And if you're like me, completing CE courses for the first time, there's a quick click link to the requirements so you can double check what you need to accomplish in order to renew your license. RegEd offers a good mix of courses across different product categories, and I like the simplicity of the payment system, as opposed to utilizing different platforms and then paying per credit, per course, or per state, depending on the platform. I highly recommend logging in and checking out what else Integrity offers as benefits for agents. We've mentioned the Integrity Health Plan before here on the show. There is also a reduced AHIP rate available for agents taking AHIP certification through the IntegrityCONNECT portal. So make sure you're tapping around in there and checking out each section on a regular basis because there's always something new and exciting popping up. While we're on the subject of new and exciting, just a quick mention here because I feel like we haven't talked about a new app in a very long time. So here we go. This one came to me through ads on Instagram, which I had a lot of time to scroll through last week while I was on the beach and by the pool. So the app is called ThingsBook. And what struck me about the app, the thing that made me download it, was the ability to catalog stuff. The name, obviously, ThingsBook, as in a book for things, but it initially reminded me of how I used Pinterest as a vision board when it was still easy to add content there. It's more of a place to document things than share things, which I feel like I'm always trying to do on social media, but it just doesn't work out in a meaningful way. If you've visited my Instagram, you know I have story highlights where I post the books I read and the podcasts I finish or am in progress listening to. Now, from what I understand so far, ThingsBook is like a digital commonplace book or a bullet journal, if you will. All the stuff that you want to track and organize so you can revisit it in a meaningful way. ThingsBook does have social components to it, but it's much more user-oriented than sharing with others, as we see on other social platforms. If you are already using it, I would love to hear how you use it and what you think so far. I will be testing it out and reporting back in a future episode, so keep an ear out for that. We mentioned a few weeks ago that we would be working on content around the Medicare GLP-1 bridge a few weeks ago on the show. Shout out to Adam, who wrote in with a great reminder about the bridge. type 2 diabetes is a disqualifier for the program. Couple other disqualifiers that we should also call out here because there are a lot of limitations when it comes to this bridge and who is eligible to use it. Those who are enrolled in Part D and already prescribed a GLP-1 drug that is able to be covered under their plan's Part D benefit, whether that particular GLP-1 drug is on a plan's Part D formulary or not, do not qualify. If a beneficiary has a diagnosis that's currently eligible for coverage under Part D, the beneficiary is not eligible for the Medicare GLP-1 bridge. CMS specifically mentions these diagnoses, quote, moderate to severe obstructive sleep apnea, non-cirrhotic metabolic dysfunction-associated steatohepatitis with moderate to advanced liver scarring, or type 2 diabetes, end quote. That quote comes from a June 10th memo from both HHS and CMS to Part D plan sponsors that covers Medicare GLP-1 bridge expectations and frequently asked questions. Some super helpful information in that memo. We have it linked in our episode notes. And one more point that I would like to highlight. CMS plans to keep a close eye on the program, calling out specifically in the memo beneficiary shifting, access decisions, and formulary exceptions. Those are places they plan to watch. And of course, anything that CMS plans to watch, we like to watch too. So we will keep an eye on that and keep you updated. Our next update, another quick one, and I don't think we've touched on star ratings in a hot minute here on the show. We reported on the lawsuit Clover brought against CMS that claimed measures included in their star ratings determination should not have been considered in the calculation. A judge ruled in Clover's favor, resulting in the recalculation of their ratings. After Clover filed, other carriers filed similar suits. And after Clover won recalculation, more carriers filed. And now, the latest is that CMS plans to appeal the Georgia court ruling that gave Clover the win. So we will continue to follow along with what this means for not just Clover, but the other carriers involved in this lawsuit, and we will report back here. Now, throughout the saga, I have been following along with Jen Kerfoot, president and COO at Duos. She's been dissecting this case and its implications through what is now, I believe, an 11-part series on LinkedIn. And if you are not following along with her, I suggest adding her to your LinkedIn feed. She is super smart. She's great at translating legalese and makes the topic of star ratings not only fun, but much easier to understand. And we absolutely love that here on the show. Moving over to the ACA. Back in June, we reported on the Maryland district judge who struck down select provisions in the CMS 2025 Marketplace Integrity and Affordability Final Rule. Last week, while I was enjoying a lovely beach holiday, the Centers for Medicare and Medicaid Services and the Department of Health and Human Services filed an expedited appeal on the decision to vacate those provisions with the Fourth Circuit Court of Appeals. One of the biggest provisions in the 2025 CMS Marketplace Integrity and Affordability Final Rule, the time frame changes to the open enrollment period. Here in Pennsylvania, Penny confirmed that open enrollment on our state-based marketplace would take place from November 1st through January 15th. After filing their expedited appeal last week, CMS confirmed via memo on Monday this week that, quote, open enrollment at the federally facilitated marketplace will begin on November 1, 2026 and end on January 15, 2027, end quote. With those dates, as usual, signups for a January 1 effective date must be completed by December 15th. And then the remaining enrollments made from December 16th through January 15th will have a February 1 effective date. I want to say that CMS made this announcement because in their legislation, they have mentioned this a few times. They are trying to simplify the ACA enrollment process for consumers. And having the same enrollment timeframes does help to reduce confusion. As far as the other stayed provisions mentioned in the decision that's currently being appealed, the $5 premium penalty for passive coverage renewals, past due premiums potentially hindering enrollment, tax credit reconciliation, stronger eligibility verifications, household income reporting, income verification, and changes to the ranges for actuarial value calculations. What's interesting to me is that CMS and HHS proposed a schedule in said appeal, with arguments occurring between October 27th and 30th, and a request for a decision by December 31st to, quote, avoid potential mootness, end quote. Hopefully, the court will not wait that long to decide, because that would indeed be moot on a few levels. However, they do also mention in the appeal, quote, if this court issues a decision before HHS proposes its next rule in early 2027, HHS can maximally benefit from that guidance, end quote. We will continue to keep an eye on this appeals process, and we are bringing you this update to keep you in the loop about what's going on. Depending on what happens with this litigation and potential future guidance, this is all subject to change, but here is where we are at for now. My recommendation, keep listening and follow along with us as we all navigate what is going on together. Now for this week's shout-outs. Violet, Danica, and Roxanne all helped to get the info together on the CMS and HHS appeal to the stayed provisions in the 2025 Marketplace Integrity and Affordability Final Rule. Thank you all so much. And another shout out to Adam for writing into the show about the Medicare GLP-1 bridge. Special thanks to Max for the interview yesterday. I cannot wait to dig into production and get that out on the feeds. And then shout out to Rehoboth Beach for a fantastic vacation and the ability to relax and refocus with a little salty sea air. It is amazing what that'll do for you. But that's all we've got for this week's Friday 5. If you have feedback for the show, you can send it in to us at asgpodcast@ritterim.com. We would love to hear from you and give you a shout out here on the show. I hope you have a great weekend. Stay healthy and stay safe out there. And we will see you next time here on the Agent Survival Guide podcast. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Emily Ryan. Podcast design by Urban Rivera. Like what you hear? Follow along with our show wherever you get your podcasts.